kiss for you.
My name is Melba Namanyana. I am a physiotherapist here at Vilakazi Health Care Center. So today I'm meeting a new client who was referred by the doctor that I'm working with, and she suffers from knee pain. Push all the way until it was straight. Push is there pain? Pain anything? Push down, push it, push down, push. Any pain? So basically with any knee patient that comes in with a knee pain, we have to look at if there's any history of trauma. Then we start thinking ligaments could be, either torn, ligaments could be stretched, overstretched, or whatever the case may be. We also look at the type of work that they do. Do they have to be squatting a lot? Do they have to be on their feet a long time? We can use ultrasound to treat swelling, pain, to help with clearance of the fluids around the joint, and also to reduce the pain. We can also use an interferential therapy or a TENS machine. So that one also sends electrical impulses into the joint to try and increase blood flow, so that if there's any exudates from the joint, they can be taken out and then the pain goes down. I'm gonna go for about 4 minutes now. If you feel heat or anything like that, just let me know. You might feel like vibrations going into your knee. Yeah, just let me know if you feel any heat or anything like that. This one that I'm going to put now, it's part of electrotherapy, but it's called interferential therapy. So Leona, it sends electrical impulses, right? And then helps to increase blood flow and also generate, reduce pain. Helps with pain reduction. It's gonna feel like it's pricking you, but it's not painful. It's just that's how it is. Yes. Okay, it's gonna go for 10 minutes. Because when I swelling, kinesio tape also has properties of encouraging fluid drainage or lymph drainage. So we're going to do it in a spiral format. Cut into small pieces. It's going to stick on her skin. Kinesio tape has a lot of benefits like pain reduction, reducing swelling. So we're just going to put it on her skin in a fashion that's going to assist reduce the swelling around the knee. And then we're also going to put another type to stabilize the knee so that she feels a little bit more stable, and that helps with pain relief as well. Yeah, so I'm just preparing it while she's still on the machine, so that when she's done we can get into it. Because she came in with swelling around the knee, so when we do the kinesio tape like this, its properties is to absorb the fluid that is underneath, to help it to the swelling to go down. And then when the swelling goes down, obviously then the pain will also go down. Okay, it stays on for 4 days. It's completely water resistant. You just need to avoid putting oil around. But and then it's after 4 days you take it off. If it becomes very itchy to the point where it feels like it's digging into your skin, you immediately take it off, because it will mean that your skin is allergic to it. So ideally we should have to put it here on for the day, then you come back the following day we do it. But because we want to treat, we treat it as it is. If it starts getting itchy, you can still take it off before the 4 days. But it has to be like itchiness where it feels like it's digging into your skin, then you know it's your skin is allergic to it. Okay, but it stays on like that. Okay, then you're gonna come back to me next week. Then we reassess, also check how the pain is doing after the modalities that we've done.
Okay.
All right, ma'am. Sure. So now that we're done with the patient, we're just going to send her home, right? I've put on kinesio tape on her knee. Also showed her some of the exercises that she can do at home. And then the biggest advice is for her to rest her knee, so to avoid standing for those many long hours. Fortunately, she's not going to work at the present moment. And then we're going to follow up with her in about 5 days. So the kinesio tape that I've put on her, the purpose is to reduce the swelling. And so after 4 days, 4 to 5 days, she's going to come back to me. We're going to review and see how the treatment that we've administered has worked for her. Obviously, I've also told her that the kinesio is completely water resistant, so she can still take a bath in it, but also avoid any oils around it. If it becomes itchy, she can take it off, just so that we don't have her having an allergic skin reaction to it. And then as well, when she comes back, obviously we're going to take a look at the swelling. If the swelling is still the same way, then we need to review our treatment. Also, we give her more exercises that she can do to try and build up the strength of those quad muscles that are very, very essential in keeping the stability and the strength of the knee.